In this video, I'll be demonstrating the sideline gapping manipulation. A gapping manipulation aims to distract or open targeted facet joints. This differs from an articulating manipulation when the manipulation moves the joint along its normal glide or motion path. In the lumbar spine, facets are primarily oriented in the sagittal plane, and side bending and rotation are coupled. This is key for locking. By positioning the pelvis and trunk, we tension the segments above and below, isolating the targeted facet for the thrust. Step 1. Locking the lower segments, pelvic lock. Start by having your patient lie on their side, with the side to be treated on top. Have the patient scooch forward so their fist width away from the table's edge. Palpate the interspinous space of the targeted segment. Support the legs, flexing the hips until motion is felt at the segment. Straighten the bottom leg and place the top leg on top of it. Now let's look at this from an anatomical perspective, using T12 and L1 as a reference. Flexing the hip upward until motion is felt at the T12 L1's interspinous space results in side bending rotation in this case, which effectively locks all segments below and up to the targeted segment. Step 2. Locking the upper segments, trunk lock. Now switch your palpating hand to the bottom hand and target the interspinous space. Grasp the patient's bottom arm and have them hold your shoulder. Pull the arm straight out at a 45-degree angle toward the ceiling until you feel movement at the interspinous space. Going back to our anatomical illustration, this setup creates coupled motion, rotation, and side bending, opposite of the lower lumbar spine pattern. By locking the upper segments, we can better isolate the targeted level. Think of it like wringing out a towel. One hand rotates one way, the other the opposite. Just be cautious with this analogy though. Too much rotation can skip the intended segment and add unnecessary myofascial tension. Step 3. Positioning and aligning your vector. Loop your top forearm through the patient's arms, with your fingers resting over the superior vertebrae of the target segment and your forearm contacting the rib cage. Position your bottom forearm across the PSIS, staying tall without leaning, and rotate slightly caudally. Keep your elbows tucked close and maintain body contact to minimize space between you and the patient. Now roll the patient just enough to line up your vector. You should feel a firm end feel. The patient should perceive localized pressure, not an aggressive stretch. Step 4. Thrust. Now it's time to check in with our patient for our pre-manipulative hold to ensure we are not reproducing significant pain that would impact the tolerance to the technique. Once clear, deliver a high velocity, low amplitude thrust. Direct the force of the top arm toward the patient's opposite shoulder and the bottom arm toward your distal hip. Okay, now let's recap. Have the patient with the target side up and scoot a few inches from the table. Palpate the interspinous process and use neutral locking. Pelvis locked below, trunk locked above with coupling motions. Roll the patient to align your vector, stay tall, and avoid leaning. Check in with your patient, take up the slack, and deliver a quick, precise thrust toward the opposite shoulder and your distal hip, isolating the targeted facet for optimal results.